Hello, my name's Olivia, and this is my presentation about lead poisoning and how to care for children with lead poisoning. Lead poisoning has been a declining problem in the United States, but we still see upwards of 580,000 cases per year. Studies show that no level of lead is safe for anyone. However, many older buildings still contain lead water pipes, and many older woodworks contain lead paints, which is very unsafe because some toys could contain the harmful lead. Okay. So, young children are extremely sensitive to lead paint since their brains and nervous systems are still in development. They are very vulnerable to lead's harmful effects. Lead builds up in children's brains, bones, tissues, and kidneys. And if the child is exposed to lead repeatedly, some symptoms of lead poisoning begin to appear. Those symptoms are irritability, loss of appetite, headaches, nausea, unexplained abdominal pain, muscle aches, constipation, impulsivity, and learning and behavior problems, short attention span, aggression, and intellectual disabilities, and sleep disorders. While research has shown that high levels of lead can significantly lower a child's IQ, the CDC recommends that children of 12 to 24 months of age get a blood lead level test. This helps identify early levels of lead poisoning and also helps to prevent lead poisoning. Lead poisoning prevention requires removing hazardous environmental sources. Children are also encouraged to wash their hands frequently to prevent the spread of contamination, and to keep their hands and objects out of their mouth to prevent lead from being ingested. Removing shoes before entering a classroom can also be used to help prevent the spread of lead. So, how to take care of children with lead poisoning? You could allow the children that have been affected by lead poisoning to have access to an education that meets their developmental stage, because lead poisoning does affect the child's brain. Having those special needs classrooms that a child could really be taught slower, at a slower pace and at their own pace, is very beneficial for the child. Also, just providing extra help to the child because some of the symptoms are a short attention span or aggression. So after a while, they could start to get annoyed with the work, and because the lead has significantly lowered their IQ, they are no longer on the level of their classmates. So allowing those children to get extra help could significantly benefit their school and education. Okay. So schools need to look for signs of lead poisoning in children. If they suddenly become very irritable and they begin to have a short attention span or aggression. These are not sometimes always lead poisoning, but it is important to check. So schools could also encourage families to learn about lead poisoning and provide advice to families about their child having lead poisoning, which is not only beneficial for the parents, but it's also beneficial for the child, for the families to know, and for their school to be educated so they feel accepted.